Oh man, hello friends. It has been a morning already. If you saw, this is my second time going live today. Because the first time that we went live for this expert interview, my phone quit on me when I was trying to download it to put it up to IGTV. So Adrianne thankfully has agreed to do this interview again. So yeah, if you've already jumped on before, you're going to hear a lot of the same stuff. But if not, please join us. Thank you for being here. So right now it looks like Instagram is letting people know that the video is going live. So I'm just waiting for folks to jump on and for Adrianne to come on and do this video for the second time. It'll be fun. I hope you guys are having a better day than I am. All right, here she is. Okay, give me just a second to get her added. And she should be joining any second here. Oh my gosh, thank you. I can't believe that happened. It makes it more interesting. Hey, we'll look at it as a, rehearsal.
That's basically what I'm thinking about it too. It's all good. These
Awesome.
things happen.
I know. Well, I appreciate you coming on here a second time. I really, really do. I know it takes time out of your schedule, so I appreciate it. Thank you.
Oh, it's okay.
Awesome. So let's just jump into it, not waste any time. So for those of you who don't know you and things like that, why don't you tell us a little bit about yourself, about your business, and a little bit about your background?
Sure. My name is Adrianne Ortega. I'm business owner of Alma Acupuncture, and I'm an acupuncturist and herbalist. I am also the only bilingual Latina here in San Antonio that is also ABORM, part of a fellowship of the American Board of Oriental Reproductive Medicine. So that's a little bit about me. So I specialize in reproductive medicine as an acupuncturist.
That's awesome. Very, very cool. That kind of leads me to my next question is, so you say that you specialize in fertility, but how did you find that passion? Or what made you want to go into that specialty?
Basically,
And acupuncture in general, sorry. Yeah.
Yeah, yes. So basically in my mid-20s, like I was 24, 25, my immune system was having a really, really hard time. And with having immune issues, I also started suffering from menstrual cycle issues that were definitely out of the norm. And at that time, I went to lots of doctors, had lots of blood tests, went to naturopaths, chiropractors, all kinds of just healers, practitioners in all kinds of different modalities. And I didn't really get a lot of great answers, unfortunately. From my physicians at the time, I got a lot of, "You're fine. This says you're fine, so you're fine." But I was not okay. I did not feel like I was 24 or 25. I felt basically I had some really intense chronic fatigue kind of issues. And then that kind of spilled over to, it wasn't ideal for my menstrual cycle. And so someone recommended a specific acupuncturist at the time, and she specialized in that gynecological issues, and I started to feel better. So I guess the rest is history.
Yeah, that's awesome. Well, I'm glad you were able to find help. And it's interesting because I didn't know in acupuncture that you can specialize in different things. So that's really, really interesting. This also leads me to my next question, which is, do you only work with infertility treatment patients or just women? What kinds of clients do you usually see?
Right. So before jumping on here, kind of scanned what my week kind of looked like, right? And so tomorrow I have 8 patients, right? And so 6 out of those 8 are reproductive patients. And then I have another patient and she has lupus. And then the other patient, I think she's coming in for fibroids. So not necessarily fertility, right? But you also have to think about like reproductive. So anything that has to do with like the reproductive system,
Mm-hmm.
I can help treat usually, right? So like later on in the week, I have a patient with insomnia. Another patient I have, she has MS. Another patient has an anxiety disorder. So, you know, it's not just females that I see. I would say probably depending on the day, it can be anywhere from 80% to 100%. You know, most of my patients are females, right?
Yeah.
And then some of my patients, you know, I have pediatric patients as well.
Yeah,
And then
that's
I have,
interesting.
yeah, and then I have male patients. So sometimes, you know, there's a male factor fertility issue going on where,
It's such a good point to bring up because, I don't, when you think fertility treatments, a lot of times people just think, okay, just the woman, but but it's nice to know that you can also help treat the male side of things because sometimes things are going on there.
for sure, definitely. And then, so yeah, so it's, you know, improving sperm count and more importantly, improving sperm quality also.
Yeah, that's awesome. And I know that you mentioned pediatric patients. That's, I think a lot of people don't, because I've gotten that before, and I know like Dr. Erica, the chiropractor, has gotten that before.
Right.
But oh, I didn't know that a
Mhm.
child or a baby or whoever, a young person, can get this. So what age ranges do you usually treat with pediatric patients?
Yes, yes. So I had this question just recently on my stories because on Wednesdays I like to kind of open it up on stories and have people just ask me questions. So I get really good questions. And I think it was 2 weeks ago, not last week, but 2 weeks ago, where someone asked what's the youngest. And if I remember correctly, she was 2 weeks old.
Oh wow, baby.
Baby. She was like a little baby. Yeah. Yeah, she's baby. I think she's 3 now.
Oh,
So yeah, so she was like my baby. I remember her. She's so sweet. Yeah, and people probably will not think about me, but I think because I treated her mom during both babies, her first baby and then her second one, her mom just kind of just knew that I treated all kinds of things. So her little one, what happened was that she basically got conjunctivitis, pink eye,
oh,
and breast milk wasn't helping. And then and then mom was like, I'm not gonna put like gel on. She didn't want to put gel on her eye, and she was like, can you help me? And I was like, yeah, I think so.
yeah.
And she was fine. Yeah.
That's awesome. And I think that you're absolutely right. A lot of people, don't think like because they don't know what acupuncture can do or what it can help. And that's why I
Right.
really like doing these types of
Mhm.
interviews to let people know that there's different forms of help out there. So that's really, really cool. Awesome. Good to hear that. Um, so I know a lot of people, especially when I've referred first time people to you, they don't really know what acupuncture is, how it works in the body. Could you talk to us a little bit about that? Like, what is acupuncture, and then how is it helping when you're stimulating those different spots? How is that helping their condition or their issue or concern?
Yeah, that's a really common question. So basically, you know, I learned about 300 points, right? I don't use 300 points.
That's a lot.
It's just not, it's ridiculous. It's kind of amazing at the same time. So there's all these points in the body, and so certain points, you know, are really good to regulate menstruation. Some points are really good to get rid of headaches. Some points are really good for a cold. Some points are really good for the eyes and what have you, right? So then I try to just choose those points according to what my patient needs and their diagnosis. So then I see the body more as an environment, right? It's an environment. And so what I'm going to do is, you know, it's like you think about like parts of our body, they're like rivers and streams, right? And so sometimes there's things that block those rivers and streams, like in the environment, right? A
Mhm.
tree falls down and then you have to kind of go around the log, right? You have to go around the tree and kind of figure out. But what I'm trying to do is like trying to get that tree to get out of the way.
Yeah. And
In
I
a
know,
sense.
yeah, and that's interesting because I know that you, in the previous one, I was asking you, because I know a very, very little about acupuncture, and I've heard a lot about like meridians and energy lines, and
Mhm.
how does that work with acupuncture, or is that even the same thing?
Yeah, for sure. It's the same thing, right? Like, I mean, everything has energy, right? Like, my sweater has a certain energy, and the chair I'm sitting on has a certain energy, right? So everything's energy, right? But so like the way I'm seeing it as you're like a fit, you're an environment, right? And so we want to keep. I want to help the environment to stay in its best form,
Yeah.
right? We don't want there to be too much precipitation, right? We don't want it to be too hot. We don't want it to be too cold. So basically, we want everything to be harmonious and well.
Yeah.
So then I do certain things to help that.
That's
And
awesome.
so basically, I'm trying to help your body with an acupuncture needle to access its natural resources so it can heal itself.
Yeah, that's really, really interesting. Very cool. So my next question, you kind of mentioned this a little previously, but why would somebody receive acupuncture? Like, what kinds of things are you seeing or are you treating that acupuncture can help with?
So obviously, like I said, because I specialize in reproductive medicine, most of my patients, like for tomorrow, are reproductive.
Yeah,
Okay, so
I just
most of
think
my
that's so cool that you can help with that. That's awesome. Sorry.
no, it's okay. Yeah, it is pretty cool, right? It is really cool. So anything that has to do with reproduction, it could be, anywhere from preconception, conception, during pregnancy, postpartum, and then throughout, your childbearing years to menopause. I think a lot of people, don't think of me also during menopause. But there's a lot of really good research that acupuncture really helps with hot flashes. It helps with vaginal dryness, incontinence, postpartum, and then menopause, all of that, right? And so other things I help with is pain, right? I also help with gastro issues. So anything that has to do with the stomach, intestines. So we can think of IBS, Crohn's, constipation, urgency, like again, like I was saying, urinary, people don't think of me, right? Of when incontinence issues, right? UTIs, chronic yeast infections. I've treated that a bunch of times. And unfortunately, Western medicine doesn't always have a lot of options for treatments, right?
Yeah.
So like, unfortunately, so if we think about UTIs, there's basically like just some antibiotics that you can take and that's it. There's nothing preventative
Yeah.
that I can think of, right? So there is something that I can do preventatively and that I can also do acutely.
That's awesome. So what other things? I mean, okay. So one of the things that I really do like that you do, especially in your feed, is that you post what I've treated this week. And there's just so many different things. And like you said, not many people think of you or think of acupuncture as a way of helping that. And I like that it's an opportunity for people to utilize that as a more natural method as opposed to medication. Of course, every different modality has its place, right? Like medication, when you need it, you need it. But
Absolutely.
if there's another, option that could potentially help, I think that's such a great opportunity for people, especially if it's a more natural way. That's awesome.
Yeah, absolutely. And I think sometimes people get confused and they think, oh, well, if I'm doing acupuncture, I can't take my medication. That's not true in my experience, right? I have plenty of patients that, I also treat people that have allergies. I have patients that have a panic disorder, an anxiety disorder, or just have general anxiety, right? Depression. And they can still see me while they take their medication. And then there's also patients that want to see me to kind of, because they want a different option, because they kind of hit a plateau
Mm-hmm.
in their treatment. So it's really nice to either get an adjunctive treatment with me with acupuncture. And sometimes, I mean, I also have patients that have anxiety or they have depression or a combination, and they'll still take their medication and they'll still take herbs and acupuncture adjunctively. So I think that's, people think that it just has to be one way or the other. And I feel like we need to be more integrative about it sometimes. And it's not a, it's not a one size fits all. And I think sometimes in other modalities, generally speaking in Western medicine, they're just like, okay, well, you can do this, this, and this. And once you do that, they're like, oh, that's all we can do. So I think what's really nice about the medicine I practice is that there's usually, it's not like just like, oh, I have one formula for anxiety. No,
Yeah.
I have like 6.
Oh, wow. Yeah.
Do you know what I mean? Yeah. And then it can be like a question of dosage. And then it can be a question of like, oh, okay, well, what else are you doing before you go to bed? Or maybe we could add this in the middle of the day. Or maybe there's just so many ways that we can actually make things more custom for a patient in the medicine that I practice than you can sometimes in just Western medicine, which is what I really like, right? That I'm treating the whole person, not just hot flashes. Does that make sense?
Yeah, because there's other things associated with that. Like you mentioned in our last interview, like with hot flashes, they're probably suffering from anxiety as well when that happens, or stress.
Yes, because that is not comfortable.
No. And I like too that you mentioned like it being more integrated, not even just with like medicine, but like you and I, for example, we share patients, and the birth network that we're a part of.
Right.
A lot of us share patients and we talk to one another because what you do treats a certain thing, but I may be also treating a certain thing or a different thing, but like it's working together to make this person feel better.
Right. I think integrating different modalities is essential for a lot of patients that don't just fit in this perfect little box of ailments and issues and diagnosis.
Yeah, absolutely. That's awesome. So my next question, because I think especially people who've never experienced acupuncture, this is a big one, but what does acupuncture, especially with you, look like? Can you walk us through that process and just kind of go a little more in detail with what they can expect?
Yeah, for sure. So people are a little surprised on my intake. It's actually probably a little bit shorter than it used to be. But so like we were talking about, so I see the whole body, as a whole environment, right? So I don't see things as just like isolated. And so the reason I do that whole intake is because then I get an idea of like, oh, there's something else going on, or there's also they're coming in for, you say, hot flashes, but they also have issues with digestion and they're also losing hair. Okay. So then I'm like,
Yeah, with hair loss. That's awesome.
right. So like people don't think, I'm like, oh, maybe that's not urgent right now, but maybe we can look at that in a month or two and address that. So let's get you feeling comfortable and let's get you to like also not be losing hair, right? Wouldn't that be great? So that's what I'm saying. So people are like, oh, I didn't even know that you treat hair loss. So that's why I do have a pretty extensive intake. And so we talk about the intake, we make sure that's all addressed. We go over like a diagnosis, any kind of traumas, and make sure that everything, I know a person's like whole background, right? And then patient lays on a massage table just like yours. And then I clean the areas with alcohol where I will be doing the acupuncture. And then I do the acupuncture. I'm pretty quick. And then normal sensations are a slight prick, heaviness, pressure. It might get warm in the area because there's an increased amount of blood flow. I let the patient rest for about 5 to 7 minutes. I pop out. I come back in. I kind of re-stimulate the needles to kind of remind the body that they're still there. I'll pop out for another 20 minutes, come back in, take them out, be good to go. And so most people, I would say somewhere like 95, 97% of people that come in, from the time they come in to the time they walk out the door, they feel different. Is everything gone and 100%? Not usually. However, people feel different because their nervous system is much calmer. It's like pushing reset on your nervous system.
Yeah, that is so cool. And you kind of mentioned this a little bit ago, but I do want to ask because like I know a lot of people have had this question, but like, does it hurt? And of course, everybody's level of pain is different. And you worked on me, and for me, it didn't hurt. I mean, there was a bunch of needles. There's one behind my ear that I think was a little sensitive, but you
Mhm.
adjusted it.
Mhm.
But generally, is it something that's painful? Because I think that can be scary for some people.
Yeah, of course, right? Like, I feel like it's totally normal, doing something for the first time, something that is foreign to this country, right? It's not from here, it wasn't created here. So yeah, you're just like, how can this help me, right? So, but like I'm saying, acupuncture is a way of helping your body access its natural resources to heal itself. That's it. That's what I'm doing, right? That's what I'm helping your body do for itself. So I have a needle here,
Yeah.
and so you can kind of
Oh my
see
gosh.
it.
Yeah, you can barely see it. Look how teeny tiny that thing is.
I'm
Oh,
trying
yeah, if you find the
to.
light. Yeah, there it is.
Okay.
It's really, really little.
Yeah, these are pretty amazing. Okay, so then, like a normal syringe, it'd be about 16 of these,
Wow. Yeah. And people,
right?
get syringes all the time getting blood drawn or shots or what have you. And
Right. To go, yeah, go get it, your thyroid analyzed, right? But this, like once it's in, you don't really feel it. And then most of the time, my patients fall asleep. I mean, if you watch my stories, my patients are pretty awesome. They'll like post pictures and then I'll repost them and they'll be like, oh, I had the best nap ever. And it's because your nervous system is so much calmer.
yeah. And you have a gentle touch. Like again, like I said, for me, it wasn't painful at all.
No, yeah, my philosophy is like no pain, no pain. Like that's not what I'm going for.
Yeah.
And
That's
so yeah, so I treat my patients the way I like to be treated, so I don't necessarily feel that it has to feel really intense or really, really strong. So most of the time, yeah, most of my patients don't
yeah.
really, yeah.
So the other question too, because I know that you mentioned that you have some pediatric patients.
Mm-hmm.
So do they get the needles too? Because I'm just like imagining a toddler or something. How does that work?
Yeah, yes. So I do know that there are acupuncturists that do needle, like little ones. I don't needle little ones. Like I have a hard time with that. I haven't had to do that.
Mhm.
So that's not what I think I need to do. Like I did mention, like I had that she was 2 weeks old, right? So I didn't do acupuncture on her. And so I have this medical grade laser that I use.
Looks like a pin.
It looks like a pen. So that's what I use. You can see that,
Awesome.
sorry, right? So then I put it on the point. And so what usually happens with this is I usually have to like distract the child because then they want to like move in. They think it's so cool. And I'm like, no, it has to stay right there, right?
Yeah.
So I have to like get like a stuffed animal or mom or dad have to get like a screen. Something has to like distract the child depending on the age, right?
Yeah.
But like, yeah, my 8-year-old, she just asked for needles 2 months ago. She's 8. So I was thinking it was going to be like, oh, she's not ready yet.
Yeah.
No, she like asked for them. So yeah, it went fine. She took it like a champ. And that was, yeah, I guess
That's awesome.
yeah,
How
it is
cool. What a
awesome.
cool job for your mom to have. My mom sticks needles in me.
Yeah, I don't know if she thinks it's that cool,
Oh,
but I
I
mean,
would.
I don't know. I can't even imagine what she says on the playground. I can't even
Yeah.
imagine. Anyway, sorry.
No, it's okay.
It's just funny to think about, right?
Mhm.
But yeah, so that's what I do. I think I have needled a 7-year-old, but I feel like that 7-year-old, now that I think about it, it was a really special case and he was totally fine with it. My other pediatric patient that I have right now, he is 6. I do not do needles on him. He's coming in for nighttime enuresis, which is nighttime bedwetting. And so, his mom contacted me because she was like, well, the doctor says he can only give him this medication and that's it. I feel kind of weird giving him a medication. And she's like, he's 6. What is that appropriate? So mom contacted me, and so it's what I'm seeing him for. He doesn't get needles. He gets the laser. And then I have another patient that I'm seeing. I do needles with. He's 9 years old, and nine's that weird age. It kind of just depends on the child. I kind of just gauge it.
Yeah.
And for anxiety. And OCD. So it's like a little bit of a different case, but he's great.
Awesome. Real quick, sorry, I just had a notification pop up on my phone that my phone might, I have this where I can only use Instagram and Facebook for a certain amount of time. So there's a chance my phone might pause. Let's hope we don't lose the video. I don't want to exit out of Instagram to like turn it off. So yeah, if it pauses, you guys, that's why I'm going to hit ignore, and hopefully it brings me right back. So that might help then in about 2 to 3 minutes, but
Okay.
sorry about that. Okay, so my next question is sorry, my jaw just popped. How do you feel that acupuncture and massage works together, or does it work together? What are your thoughts on that? I love asking this question because, of course, I'm a massage therapist, and I do refer out to different practitioners such as yourself. So how do you think massage and acu work?
Well, I feel like it obviously works well because we've shared patients, and I feel like we treat them, and it's complementary, right? Like it's adjunctive, and I feel like, we're doing the same thing and just going about it in a different modality. I think it's great. You're lowering their cortisol. I'm lowering their cortisol by resetting their nervous system. You're relaxing their muscles. I'm relaxing their muscles and maybe helping them with other organ system issues. So I think we're together treating the whole person. So I think that's great. And I also treat jaw pain.
Good to know. I know since yesterday, I'm like, I am falling apart. I've had this like TMJ dysfunction thing, and it popped because I haven't been able to open my jaw all the way. I might have to come see you because I'm like, oh my God, my ankle, my jaw. So yeah, that was a big pop in my ear. Anyway.
Was it your left ankle?
It was actually my left ankle is the one that I sprain all the time, but it's my right ankle, which I was like, no, I need at least one good ankle. This is the right one, but
got it.
Anyway, left side of the jaw, right ankle. So I think that's great. You mentioned integrative medicine before, and you're right. Like us working together is just so beneficial for that whole person. And I think sometimes people get a little confused. Yes, we want to see you, and this brings up another question here. But we want you to get better, and we want you to get better quickly and efficiently. Right. So. How many sessions is there like a magic number for sessions that you would see somebody to help treat their concern or their issue?
Yeah, for sure. So for reproductive medicine, so if someone's coming to see me because they want to conceive and they're having trouble conceiving, then there is a magic number. It's actually 10 to 12 sessions. There's been repeated research for that, and follicles actually become more youthful within 10 to 12 sessions. So that's great. Sperm, it's 6 weeks. So that's great too, to know that there's so much research for that. And then as far as acupuncture, usually I recommend once a week for 4 to 6 weeks to help kind of build up the body to access those natural resources. And then I start to like back off, right? And so with the help of herbs, that's really helpful. Like people are always wondering, well, acupuncture, will it be enough? And everyone's situation is a little bit different, right? So someone's coming in and they're like, wow, because it's been an intense year. I have anxiety now. So maybe, they would only have to see me once a week for, 4 weeks versus someone that's had anxiety for 4 years. Then I'd be like, well, then you probably need to come in like once a week for 6 weeks. Yeah. Does that make sense?
No, it does. So it definitely depends on the person and what they're going through. And I find it interesting about the fertility treatment thing. I think it gives people I'm having a heart attack. I was like, please don't exit. I ignored the notification for the day, so Instagram's not going to shut off for me for at all today. Anyway, okay. I think it gives people such peace of mind, especially when you're going through something like fertility treatments,
Mm-hmm.
to know, okay, in 10 to 12 weeks, my body, or in 6 weeks, my body is going to be prepared to, potentially become fertilized. I think that's a really, really good stat to know for sure,
For
especially
sure.
through such a stressful thing.
Right.
So how cool. Okay, so my next question, and you talked about this a little bit previously, but talk to me about herbs. So you guys, she's a nationally certified Chinese medicine herbalist. Did I say that right? She's an herbalist, which is so cool. What I guess, what do herbs do? What can they help treat? What does that look like?
Man. Okay. Well, I will just kind of read off. So I'm looking at the top shelf of my herb inventory, right? So there's adrenal fatigue. There are these are patents. That means that they're in powder form in capsules. Okay. So adrenal fatigue, pain, hot flashes, regulating menstruation, stopping menstruation, anxiety, anxiety disorder, sleep, boosting immunity, acne, cystic acne,
Wow.
and also migraines and headaches.
Oh my gosh, that's a lot.
Yeah, so that's just like the top shelf, right? It's not like the rest of my shelves. So just to kind of just like a little bit of a range, right?
Mm-hmm.
So if you can imagine, when I talked about what can acupuncture treat, well, herbs can treat the same things
Yeah.
for sure.
That's awesome. And like in our previous interview, this is something that I want you to mention to the people watching this. You talked about how you only see somebody for an hour or so, and then they're all.
Right.
Can you kind of expand on that?
Yeah, for sure. So when people come in and they're coming in for migraines. They've had migraines for 10 years, right? And they want to get rid of the migraines. I want to help you get rid of the migraines for sure, ASAP. Okay, but when you're coming in once, maybe twice a week, it depends. Okay, so you're coming in for 1 hour out of the day, out of a week. I highly recommend taking herbs because then you're doing something daily, right? It's like that's your homework. Just like what you do.
Mm-hmm.
You have exercises, you have stretches, something that you're doing daily to help the environment, right? So that's what I want to do as well. So acupuncture is really strong in that hour, right? However, if you can add herbs to it and maybe tweak something before bedtime or midday, then all of that together, these little changes, these little shifts in helping your body access its natural resources daily, you'll get better so much faster. So I would say that, probably about 80% of my patients actually take herbs because I feel like it's actually a bigger bang for your buck, right? So you're paying for the acupuncture and the bottle of herbs is like $20, $30. Then
Yeah.
it's really going to help you heal faster.
Yeah, that's awesome. And I really, really love that because I'm a huge fan of homework. And you're right. I mean, we're only seeing you for this limited
Mm-hmm.
amount of time, like myself, an hour, 90 minutes, maybe 2 hours, but
Right.
you're all living your life doing whatever it is that you normally
Right.
do. And you need to have something that's going to support you and help you maintain
Yeah.
the wellness goals that you have. So I think that's really, really awesome. And with the herbs, that's something that they're getting from you, correct? Or is that something that they
Yeah, yes. Like 9 out of 10 times I say this is what you need. Most of the things that I recommend I have. And then every once in a while I'm like, oh, I think you need to try this, and I can send them a link and they can just buy it from someone else.
Yeah, awesome. Very, very cool. Is there any other info that you want to add about herbs that maybe I didn't ask about?
I can't think of anything. I mean, for example, like if someone's doing IVF or IUI, then they're not going to take herbs during their cycle. I will definitely say that. I'm super respectful of the IVF process, of the IUI process. I do have herbs and supplements that help prep you. So hopefully you have less side effects during that time. also that you could help for follicle, just like prepping of that. And for also for the men, for the husbands or partners.
Yeah.
I have that as well available. So totally respectful of that for sure. And then, and I think sometimes, like I was saying, some people, suffer from depression. A lot of people are suffering from depression and anxiety just recently, considering just this intense time that we have had. And then after this last week, I can imagine that there will be people that are going to be suffering from PTSD, unfortunately.
Yeah.
So, like, for example, I'll give you my example. Like, on Friday, so I didn't have water for almost 5 days. We lost electricity on Monday. So there was like a day and a half, right? Because our pipes froze, right? Friday, I was able to take my shower. On Friday night, it took me an hour longer because I had anxiety. I got up 4 times to go make sure I had opened and that there's a stream from the faucets.
Oh, yeah.
Right? And that's normal. That's normal. However, if someone is still doing that in a couple of weeks or even in April, please reach out to me or to a therapist or a counselor. I will help find you something, because if you're still suffering from something like that, that's like not healthy.
Yeah. And it's something you can treat and help with.
For sure. So even if it's not me and you don't even live in San Antonio, I will try to help find someone else for sure. Because I was really surprised that I had that, but at the same time, not surprised, because I feel like it's totally understandable.
And, all of us have gone through lots of crazy things, not even this past week, but this past year. And so I'm sure I'm seeing a lot of people with stress and anxiety, and, it's unfortunate, but, it's something that you can help with. And it's nice to know there are natural alternative routes that people can go to.
Right. And then also that we can, be integrative about it as well. Is if they need to take medication, that's totally fine. And I would say acupuncture is really a great adjunctive complementary treatment as well.
Yeah. Awesome. Very cool. Okay. So my next question is, you have a lot of credentials, and I think it's important for people to have an understanding of what that is, what sets you apart from other people. Like, why would somebody want to come to you versus somebody else who may not have that education, have that background?
Yeah. Okay. So I have a master's in Oriental medicine. So I have a bachelor's and I went to go get my master's in acupuncture and Oriental medicine herbology, right? So to be licensed in the state of Texas, I had to take 4 board exams.
Wow.
Okay. And then I also had to send off all of my transcripts and all of that, my board exams, to the national board. Okay. So I have that done. So I'm a licensed acupuncturist and herbologist here in Texas. There are practitioners that can do acupuncture, right? Mm-hmm. Without the 4 years.
Oh, wow. Okay. So it's not, and I kind of asked this before, but I just want to ask it again. So
yeah, for sure.
You have to be licensed in Texas to do acupuncture? Because it kind of sounds like you don't. Not necessarily.
Right. So like I took over 1,000 hours in acupuncture, over 500 hours in Western medicine. Okay. Mm-hmm. And then there's practitioners that can do acupuncture, but they're not a licensed acupuncturist like me.
Yeah.
So they go to some, a couple of weekends, maybe like 100 hours ish of training.
Yeah.
To do what they do. So you have to distinguish as a patient and a consumer. Do you want a licensed acupuncturist like me that has over 1,000 hours of training? Well, definitely more than 1,000 hours now that I've been practicing for 10 years, right?
Yeah.
Or do you want someone that did it on the weekends?
Yeah.
So you have to, as a consumer, you have to make the decision.
Yeah. And that one or the other is not necessarily a bad thing, because I think people, they have different needs and different expectations.
Yes.
So just like you said, as that
Yes.
consumer, what's going to work best for you? Which is
Mm-hmm.
why it's important, I think, to know about what your credentials are, because somebody may not need all of that education, or somebody may need all of that education and expertise.
Right. Am I gonna say you just have to make a decision as a consumer, and I feel like the more you know about that, the better informed decision you can make for yourself.
Absolutely.
Yeah.
For sure. Awesome. Very cool. Well.
Oh, I forgot to say. Oh, yeah. And then I'm also, like I had mentioned before, so I am a fellow of ABORM, the American Board of Oriental Reproductive Medicine. So that's different because I had to take, I think it took me about 2 years to prep, and I had to take another board exam. I had to go to Canada, go take it, and it's a 6-hour board exam, and it's all about reproductive medicine. It's all about IVF, it's all about IUI, it's about sperm, it's about follicles, it's about research, it's about knowing how to research and how to interpret it for your patients. So I think that's important to know, because I am the only female fellow that I know of in San Antonio as of now. I am also the only bilingual fellow here in San Antonio, and I believe in Texas as well. I think there's 12 or 14 of us.
Oh, wow.
And I'm the only one in Texas. There needs to be more of us.
Yeah. So if there's any acupuncturists watching or listening, or future acupuncturists.
Yeah. Yes. We need more for sure. So that's definitely something that sets me apart. I feel like it does make me a more well-rounded reproductive acupuncturist for sure.
That's awesome. Very, very cool. Okay, so also I like to ask my followers, and of course you've asked your followers, if there's any questions that they may have specifically. And you kind of covered some of this, but I just want to, make sure we get to their question specifically. But can acupuncture and herbs, can that be used for pain management?
Yes, for sure.
Yes. Awesome. And then also, the second question here was, can acupuncture help with arthritic pain? Yes.
Acupuncture is really good for any kind of flares. I'm sure a lot of people probably had lots of flares last week, unfortunately, because of that dampness with the cold.
Mm-hmm. Yeah. Very cool. And then I had my own question is, do you accept insurance?
Yes, I am in network with Blue Cross Blue Shield. With most policies. I don't think it's every single policy, but most of them. If you or someone you know works for HEB, I think I'm covered in most of their policies. HEB has
cool.
HEB has really good insurance. I'm just always like, wow, you employees have. My assistant, she'll give me all of their benefits. I'm like, holy moly, that's great insurance.
You did a good job.
Yeah, they have really good benefits for their employees.
That's awesome. And that's good to know, because, again, not many people may think about that. So always ask your insurance, guys, and see if that's
for sure. And then let's say someone has Aetna. Okay, mm-hmm. Someone has Aetna, or they have, I can't think of anything right now, but I just thought of Aetna for some reason. And that you're they have in-network benefits for acupuncture. We can still bill you out of network. It may not be exactly the same coverage, but it'll be some coverage. And even if you don't, let's just say you don't want to see me, that's totally fine. I know of some practitioners that I could refer also to. For me, like, I'm not everyone's cup of tea. I can't help everyone, but I like to also be a resource and have people, find someone that is the best fit for them, or a family member.
And I think that's good to know, because, a lot of people have even said to me, like, oh, I went and saw another massage therapist, don't be mad. That's not a thing. There's enough clients out there for people. For sure. We're fine. We just want to make sure that you, as the client or as the patient, are being taken care of. And
yes.
That means you have to go another route because that particular practitioner is covered through your insurance. That's fine.
For sure.
If you need help, always reach out to us because we're pretty open and, wanting to help people. So I think that's
Yes.
a good point to make for sure. Okay. So one of my favorite questions to ask, and I'm excited because I already know what it is. But is there anything that you want to share with the people who are watching this that can help them?
Oh, yes. This is the fun one. Oh, yeah. Okay. So this is Huang Chi. This is astragalus. So this is like one of my favorite herbs. I know that there's a lot of like popular like Asian herbs out there, but this is just like one of my go-tos. If you go to like my feed and you'll see like I just love herbs. I feel like they've been such a great resource for me and my family, and such they're just a really good resource that I help give to my patients and my family. And so Huang Chi astragalus is great, and I lean to, especially in times of fatigue. Mm-hmm. Okay, so this is really, really good for fatigue. I would actually recommend you can buy it in like powder form and capsules on Amazon.
Awesome.
Astragalus. I do not recommend it if anyone has any kind of blood pressure issues.
Okay. Does it matter if it's high blood pressure or low blood pressure, or is it blood pressure in general?
High blood pressure.
High blood pressure. Okay.
If they tend to have like any kind of high blood pressure issues, it's a no-go.
What if they are taking, because this thought came to me the last time that you asked or talked about it. Does it matter if the high blood pressure is controlled like with medication, or is that still kind of iffy, maybe not? Or their doctor?
I think they still could, but actually I think they still could. I would just say they would only take it once a day. So like if you go on Amazon and you type in astragalus, you can get them in capsule forms, and I would say like standard 2 pills 2 times a day is good to go. Don't take it after dinner because it is for fatigue. It is energy boosting. You want to take it whenever you need to be boosted, not at bedtime when you should be sleeping.
Awesome. And is it something maybe that they could purchase from you if they want to support local?
Yes, for sure. You can purchase it from me. I like sell it in bags. And so like sometimes I'll combine it with other raw herbs, and like I cook it in, I make like I guess a tea or a broth. Mm-hmm. And then I add it to like my chicken soup or beef soup.
So that's so easy. And if you're afraid about taste, I'm sure it doesn't, like, you can totally cover that.
So it's kind of like a sweeter tasting herb. So when it's not in my chicken soup, I kind of really miss it. Oh. Yeah. So I really, really like it. I really recommend it for my postpartum patients a lot. After all that Texas has been through, like in this last week, I really think it would be really good.
Everyone needs astragalus.
Yes.
Awesome. Do you mind spelling it? I'm going to put it in the caption, but would you mind spelling it so people know what to look for?
Astragalus, Astrallagus.
Awesome.
Sorry, I'm like super visual, so.
No, you're totally fine. Awesome. Well, this has been great. My last question is, how do people connect with you? How can people book?
Yes, for sure. So I am really pretty active on social media, especially here on Instagram, my stories as well, at alma.acu.texas. The same for Facebook. You can also put in Alma Acupuncture on Google and you'll find my website, super easy to find. And then if you want to call, text 210-840-9407. Sent me a DM. I'm here as a resource. We've been through a lot.
Yeah, Texas.
Talking to you, Texas. We've been through a lot. So if you need me, or you're not even in the city and you're in Dallas and you want a referral in Dallas, just reach out. I do this for my patients, family members all the time. And I'll get back to you as soon as I can. But I'm pretty good at answering DMs. So yeah, I'm here as a resource. Follow my stories. You want to, watch a little bit more, learn more about me, watch my stories. And also, if maybe I'm not the best fit and maybe you want someone for your husband and your husband really wants to go to a male practitioner, I will do my best to help you find somebody.
That's awesome. That's so good to know. She cares, you guys. She really does. And like I said, I've gotten work done on her. She's worked on me before, and it was great. So thank you so much, Adrianne. I'm
Thanks.
so happy that you did this a second time. For those of you who don't know, we already did this at 10:30, but my Instagram quit on me. So fingers crossed that doesn't happen this time. I'm going to save it to my phone first and then upload it.
Okay, sounds good. Thank you so much, Nicole. You have a good one.
You too. Goodbye, guys. Have a wonderful day.